pelvic floor rehabilitation, pelvic floor strengthening, Laycock's perfect scheme, power and strength, Oxford MMT, endurance, time period for which maximum voluntary contraction can be sustained, 35% decrease is tolerated, repetitions, the number of repetitions up to 10 of the specific MVC is recorded, allowing 4 seconds rest between each contraction, number of fast contraction, relaxation cycle in 10 seconds. HET's SURF protocol, HET's MMT, endurance, time period for which maximum voluntary contraction can be sustained, repetitions, the number of repetitions up to 10 of the specific MVC is recorded, fast, number of fast contraction, relaxation cycle in 10 seconds, HETs, that is 8 by 10, that is normal. So if there is 8 contractions in 10 seconds, it's a normal strength. So how to document? PERF, power, endurance, repetition, fast contraction. So 4, 7, 3, 6. 6 is the number of fast contractions in 10 seconds. So MMT, power, strength according to Oxford MMT. Endurance can hold at least 35% of MVC for 7 seconds. 3 repetitions can repeat the MVC held for 7 seconds 3 times with 4 seconds rest in between. Fast contractions, 6 contractions, relaxation achieved in 10 seconds, later rest period of 1 minute. This is documentation. The other documentation, progression perfect scheme, how to progress. 7 seconds 3 repetitions, 4 second rest. 7 seconds 4 repetition, 4 seconds rest. 7 seconds 10 repetitions, 4 second rest. 8 seconds 10 repetitions, 4 second rest. 9 seconds 10 repetition, 3 repetition. 9 seconds to 10 seconds, 3 repetitions, 4 second rest. 10 seconds 10 repetitions, 4 second rest. Then fast contraction to be done on overload principle after rest period of 1 minute. 10 second to 10 repetitions, reduce rest period. Change in position to quadruped sitting and standing to progress. Coordinated contraction with respiration during activity of daily living. HET's progression. 6 seconds 5 repetition, 7 seconds 5 repetition, 8 seconds 5 repetition, 9 seconds 5 repetition, 10 seconds 5 repetitions, 10 seconds 6 repetitions, 10 seconds 7 repetition, 10 seconds 10 repetition. Then fast contraction to be done on overload principle. 10 second 10 repetition, reduce rest period. 10 second 10 repetition, reduce rest period. Functional movements at hip. Then change in positions to quadruped sitting and standing. Resistance training, targeted muscles resistance or general resistance. Coordinated contraction with respiration during ADL. So changing positions, hook lying exercises progression. Sustain the pelvic floor contraction with heel slides, hook lying march with alternate upper limb movement, dead bug. Quadruped position progression, maintain the pelvic floor contraction with static quadruped position, quadruped with single limb lift, quadruped with opposite limb lift, bird dog crunches. In quadruped position, care must be taken that the patient has kept the pelvic bone posteriorly tilted. The back must be straight. Sitting to standing progression, sitting to standing chair, air squats, jumping air squats, weighted squats. In all these activities, the pelvic floor must be contracted, sustained contract. This is the protocol for strengthening. PFM targeted training, pelvic floor muscle targeted training, frequency 4 to 6 times per day, 7 days a week. Pelvic floor muscle has property to recover quickly as well as get fatigue quickly. So different repetitions can be done in a day. That's why 4 to 6 times per day, 7 days a week. Intensity 65 to 100% of maximum voluntary contraction. Time 5 to 10 minutes. Targeted training. Type strength or endurance. Functional superimposed 1 session per day, 3 to 5 days a week. Intensity 65 to 100% of MVC. Time 30 to 40 minutes superimposed training. Type strength, endurance, cardio.